Welcome to London Bridge Healthcare. Today we're joined by Dr Sarandeep Marwaha, consultant cardiologist. We'll be talking about heart screening and investigations, who they are for, and why consultant-delivered care matters. Dr Marwaha, thank you for joining us.
Thank you, it's a pleasure.
For someone who may not know much about it, what is heart screening and why does it matter?
So heart screening is essentially looking at your risk factors to see if you have any heart conditions or underlying heart conditions that don't have symptoms and you're not aware of. It also looks at investigating your heart and assessing for underlying diseases or future risks of heart disease.
And who should think seriously about booking heart screening and investigations?
Well, ultimately, I think everyone should think about it because you can get heart disease in young individuals, you can get them in middle-aged, and you can get them in a much older age group or in elderly care. So we should all consider it. You do come across, unfortunately, individuals that have had sudden cardiac death at a young age, and we do know that you have blocked arteries or higher risks of heart attacks as you age over time. So I think everyone should consider thinking about heart screening.
What happens during a consultation at London Bridge Healthcare?
Well, first and foremost, it is a consultant-delivered service. We will have a discussion with you when you come in, and we will find out about your symptoms, your risk factors, your family history. So we'll do a very in-depth consultation to know about you and your current medical condition. And then from there, we will decide and have a discussion about what tests or investigations we should consider doing for your heart to assess its risk.
And what kind of tests or investigations might I have at the consultation?
So the most basic test that we will do is things like blood pressure checks, height and weight. But a more intricate test, but basic test, is an ECG. It's an electrocardiogram. And that is often the first line of screening. It looks at your electricity that flows through your heart, and it essentially will show us if there's any underlying problem with the electricity that flows through your heart, which can be down to the structure of your heart or an inherited condition. Then there's more advanced tests such as scans of the heart called an echocardiogram. That looks at the structure, the way the heart pumps, and whether the valves are okay, or if there's any signs that your heart is failing at an early age. And furthermore, we can assess your risk for blocked arteries and if there's any scarring of the heart. They are more advanced tests, and we can do CT scans or MRIs.
What makes heart screening service at London Bridge Healthcare different?
The difference at London Bridge Healthcare is that we really care about prevention, and we really care about individualising your management and your care. And communication is very, very important to us. We want to manage this in a consultant-delivered way. So you will meet a consultant cardiologist who customizes the investigation and tests according to your needs. And it's really important for us to look at preventing heart disease and also managing it quite early. And so that is the unique thing about London Bridge Healthcare.
And finally, what would you say to someone watching this who is unsure whether or not to get checked?
I would always say, if you're unsure about getting your heart health checked, just pick up the phone. We are here to discuss things with you, and we can go through your needs and what your concern is about, and then we can help you decide whether you need to see a consultant cardiologist or have tests. And I also say, if you listen to your body, that is the most important thing. If your mind or your body is telling you that you need to be seen or you want to get your heart health checked, that is often the right thing, because people need to listen to themselves first, and it's often a sign that they need either reassurance or something may be going on, and we are here to support you.
Dr. Marwaha, thank you very much.
Thank you very much.